This patient was referred to me for evaluation of tooth number 19. According to the patient, the root canal was done originally in Afghanistan a few years ago. Prior to when I saw her in 2021, 3/1/2021, as you can see. So over 2 years ago, so 2 years, 7 months ago, 8 months ago, when I saw her. So the root canal was originally done in Afghanistan. Then when she moved to the U.S., from Afghanistan to U.S., tooth started to hurt a lot. So she was seen by dentists here. According to the patient, the root canal was redone. But patient continued to have symptoms, to have issues with the tooth, to have pain with the tooth. And when I saw her, this is one angulation of the tooth that you can see. You can see crown and build up and previous root canal. If you rely on just one angulation, I always tell you, take multiple angulation PAs. Don't rely on just one angulation. You look at this angulation PA, you really don't see much. But as soon as you switch it up and you take a different angulation PA, you start to see things. So you can see there's looks like a widening of the PDL, almost like a periapical relucency starting to form here. And take a look, what is this? Right here. Let's look at another angulation PA. Right there. That's a broken file, as you can see right there. So the two dentists, I don't know which ones, the dentist in Afghanistan or the dentist here, whichever one it was, broke a file here. So they kind of blocked themselves, and that's why they couldn't instrument to working length here, because that broken instrument right there blocked them. So no wonder this poor patient has symptoms and issues and pain and all that stuff. So again, take multiple angulation PAs. Don't rely on just one angulation PA to try to make a diagnosis. So we talked about options. I told the patient I may not even be able to remove this broken instrument. My goal would be to try to remove it, but I do my best. If I can't remove it, then I'll try to bypass it, but I can't guarantee anything. I'll do my best. I can guarantee that. I'll do my best, and we'll see what happens. Patient said, okay, let's go ahead and try. Again, as you can see, that was the date, 2 years, like 7 months, 8 months ago when I first saw her. And this is immediately after we redid the root canal for her. I was actually able to remove that little broken file. So went through the crown and removed the buildup and all that stuff, removed all the gutta percha. And as you can see, I was able to regain patency. I was able to go to my working length, instrument, irrigate three-dimensionally, and obturate three-dimensionally. Let's look at another angulation. So you can see, look at this. Look at the complexity of the apical few millimeters of the canals here. Look at all of that. So this was immediately after we redid the root canal, and here is the date, as you can see. So 2 years and a few months ago. And this was yesterday. 2 years, 4 or 5 months post-op of tooth number 19. Tooth is in full function. Patient's symptoms, all her symptoms gone away, of course. She came to see me for a different tooth, so we took PAs of tooth number 19 to make sure number 19 was doing okay. There's a crown on the tooth, prefab metal post. That's not doing really much because, as you can see, it's so short. If you want to put a post in, at least put a post in. So that will just, unfortunately, could cause the tooth to fracture here. But anyways, as you can see, the periapical relucency, that whitening of the PDL gone. Periapical relucency. Patient had no symptoms. Tooth was in full function when I saw her yesterday, and as you can see, that was just yesterday when I saw her. 2 years and 5 months. 2 years, 5 months post-op of tooth number 19. Excellent. Another, by the way, example of the fact that sealer extrusion doesn't cause endodontic failure. So as you can see right here, there was some sealer extrusion when I redid the root canal, and no endodontic failure. The endodontic retreatment did not fail. There you go.